Hello, this presentation is for the staff of Springfield General Hospital on organizational changes. My name is Carlos Martinez with California Intercontinental University student. This is a staff presentation for Management 616, March 10th, 2001. In our brief discussion, we want to share with you an overview of the problem that you have agreed exists, identification of a potential solution, which is automation. Talk a little bit about the training, how that will be implemented. We'll conclude with a Q&A session, your suggestions and feedback, my contact information. The scope of the problem, as you have acknowledged, is nationwide. That impacts many medical organizations, including Springfield. The problem is commonly referred to as ADEs, adverse drug events. These are medication mistakes. They result in 2019 in more than 700,000 emergency department visits and over 100,000 hospitalizations each year. That was in 2019. There are many studies on this, but I included one other in 2010 in the New York Times. This was a result of a 5-year study that concluded that the safety at hospitals in regard to this improving. What are exactly ADEs? Well, it results from prescription errors. You've identified this as a potential problem here at Springfield, which the basis of that is poor or illegible handwriting by prescribing physicians. They're the ones that do the prescriptions and prescribe the medications. We're going to send them to school for handwriting improvement. I'm just kidding. The other area is confusion over drugs with similar names. Another is perhaps an inadequate attention to the effects of multiple drugs and how they create patient allergies, or the patient allergies that are associated with the prescription drugs. Now, these things add to the overall cost of operation of the hospital, and they increase the errors associated with the hospital, increase potential for lawsuits and other things like that. So if the hospital can be more profitable, that creates a better environment for staff and employees. As you've indicated, that your current use of CPOE, the software system, has resulted in incorrect dosage information, discontinuation failures involving prescribing new medication and modifying existing medication, which creates lots of ambiguities because you have to search through multiple screens just in order to confirm the medication. And finally, the other problem associated with this process was patient confusion. Patients are confused because during the data input, it's difficult to really identify sometimes some patients' names. Some of them are similar, some of them are the same. And although they're color coordinated, their names don't appear on every screen that you navigate to when you're working to fulfill a patient request or modify a prescription. So those are some of the major problems associated with the reduction in cost, patient confusion, and incorrect dosage. So what are the solutions? Well, one primary solution you've already selected is CPOE. And congratulations on your use. What we want to do is implement a procedure or a change so that we can make sure that the proper input produces the results that you want to make your job a lot easier so that you don't have to search through multiple screens, as many multiple screens. The color coordination will be consistent, so every patient's name will appear on the screens as you navigate. Wouldn't that be great to have that? That will reduce a lot of time and effort, make your job a lot easier and less expensive. So CPOE, for those that are not familiar with that acronym, Computerized Physician Order Entry Program or Order Entry System, part of your IT department. Well, in order to make this a success, to make your job easier and smoother, it's going to involve your participation, your additional training, your feedback, and your evaluation of how things work. Management is depending upon your feedback to determine how well the change is working, how well the training is working, what training, additional training might you need, and in addition to that, additional um, you may have additional opportunities for advancement. So let's take a look at the benefits that we should expect from the proper implementation. Number one, a substantial reduction in errors and cost. A more accurate dosage information based upon clinical guidelines, not based upon what the pharmacy has warehouse or what has been ordered. I know that's a welcome change or expectation. Next, an accurate ordering of new medications and medications to be modified. Substantial reduction in confusion. More consistent screens. And finally, software modification. We're requesting software modification because each one of your departments have some unique protocols. And CPOE has been designed and created to operate smoothly in all of your departments. So we're looking forward to you providing the feedback to meet your unique requirements to make your easier and more fulfilling. Computerized physician order entry system is going to require the following. Number one, all physician prescriptions for medication and treatment will be entered into the system. Number two, the computer entries will be available to all hospital staff and employees, including those for treatment and the pharmacy staff as well, so that everyone can cross-reference, verify, and confirm accuracy. The system would catch all prescription errors, incorrect dosages, duplicate requisitions, patient allergies, adverse impact statements of multiple medications that's being prescribed to each patient. So if properly implemented, the system will do all of this for you. Let the system do the work so you don't have to. The system would display the patient's complete medical history as well as the latest clinical guidelines for treatment, and we will attempt to make sure that each screen has the patient identification information and their name, even though it is currently color coordinated with proper typefaces. That would make your job a lot easier. We are planning that your new skills will create new career paths or improved opportunities for increases in pay and wages. certainly an improved working condition and climate. And finally, your patient relationships will be enhanced substantially. A reduction in complaints and a reduction in prescription. The change implementation is a three-step process. Number one, recognition of the problem, which we've done. Agreement that that is the problem. Those are the major areas that need correction. Number two, recognize a credible solution, which you've already done with the system that you're using. But we need your engagement, interdepartment, and in the departments as well to engage, provide feedback, and make a commitment to making the changes and the new training work. And the third step is the actual implementation, where we evaluate, test, and look forward to your feedback because the system will roll out in a beta test, which means a pilot. So one or perhaps two departments will be identified to test the system. That testing period will be an opportunity to identify potential issues that may be a problem for the full implementation. It's an opportunity for you to learn new employee skills, and it's an opportunity for you to evaluate your performance on the system, an opportunity for potential career advancement, and for those that achieve high performance, there would be some type of recognition for them as well. So we're looking forward to your feedback to help us help the organization improve their training methods for new employees and to expand this benefit throughout the organization. At this time, I'd like to invite questions and suggestions, but in the end, the final takeaway is we're hoping that Springfield General will become a model in the healthcare industry. Thank you for your attendance.